This is the room that we will be doing our assessment in. Okay. How do I flip it back now?
I don't think you can.
I can't. Okay, hang on. Okay. All right, so I'm gonna walk in. I'm gonna pull the curtain shut. I'm gonna introduce myself. My name is Terry. I'm your nurse today. I'm going to be doing a head to toe assessment on you. Wash my hands. It is. It's recording. Can I have your initials and your date of birth, please?
WRH
Date of birth?
3785.
Excellent. Okay, WRH. Nice to meet you. I'm Terry. First things first, I'm going to do a psychiatric exam. Do you know what day it is today?
Sunday,
It's Sunday. Do you know what time of day it is?
noontime.
Noontime. Excellent. Do you know who the president is?
Joe Biden.
Joe Biden. My patient is alert and oriented ×3. Okay, next we are going to go with, can I have you count backwards from 50 by 10?
50, 40, 30, 20, 10, 0.
Excellent. I am going to now test your long-term memory. Can you tell me what you did last year for your birthday?
I went to work, I came home, had a little party with my kids and my girlfriend, and then went to bed.
Awesome. Okay, now I'm going to give you 4 words to remember. Can you remember red ball summer scuba?
Red ball summer scuba.
Excellent. Okay. Can you now count backwards from 20 by 1s?
20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Excellent. Can you remember the 4 words?
Red summer ball scuba.
Excellent. Okay, that concludes our psychiatric exam. The patient is alert and oriented ×3. Okay, now we're going to go into and assess your hair, skin, and nails. So I'm going to just start at your head. It's okay to touch you.
Yes.
Okay, so I'm just going to make sure everything's symmetric. He does have some thinning on the top. Alopecia is noted. Otherwise, hair is equally distributed and looks normal. Next, we are going to assess the ears, look for any drainage. Everything looks okay over there. Any deformities, everything's all right. I am going to test skin temperature on all extremities. Everything is warm and dry. Now I am going to grab my pen light and I'm going to, let's see, test your eye, your vision, okay? We are going to follow the pen light with your eyes only, okay? Okay, and now can you keep your eyes straight on this and follow it? Excellent. Okay, now I'm going to shine the light in your eyes and watch for the accommodation. Okay, so the patient's eyes are equal and reactive. All right, now we're going to perform the whisper test. I'm going to whisper a word behind your ear and you can repeat it.
Scuba.
Ocean.
Ocean.
Excellent. Okay, hearing is intact. Now, can I have you close your eyes and I'm going to give you 2 different things to smell. See if you can identify it.
Skittles.
Very good. Okay.
Cologne.
Excellent. Okay. Can you hold out your hands while your eyes are closed? Can you put your palms up? I'm going to place an object in your hand. Can you tell me what they are?
Feels like a coin.
Yes.
Fingernail clippers.
Correct. Okay. Now I'm going to draw a letter on your hand and can you tell me what it is?
B. A.
Very good. Okay, you may open your eyes now. You can put your hands down. Okay, now I am going to look in your nasal passageway. Can you tilt your head back? And take a peek in there, see if there's any septal deviation. There is not. Everything looks normal. It is moist in there as well. Excellent. Now I'm going to look in your throat and, okay, so uvular and pharynx are midline and tongue is in the midline. Everything is symmetrical. It is moist in there. Can you stick out your tongue and go ah?
Ah.
Okay, excellent. Now I'm going to test your trigeminal nerve. Can you open and close your jaw? Excellent. No clicking noted. I am now going to assess your lymph nodes. Going to run down your neck, down your clavicle, and then down in the axillary region for lymph nodes. Testing for any swollen or tenderness in there. If you do at any point feel any pain or tenderness, please let me know.
Okay.
Okay, so that concludes the hair, skin, and nails, vision, and whisper test. The Solon test would be given to you if we had the time. You would hold a piece of paper 14 inches from you, close one eye, and read the slowest line that you can, and you would do it with the other eye. This would determine if your vision was 20/20 or not. Noted the patient does wear glasses for distance. Next, we will go through, we will listen to your lung sounds. Okay. I'm going to come around the back side. Go this side. Alright. Can you scooch forward? Okay. So, I'm going to have you say 99 when I touch your back.
99, 99, 99, 99.
Okay, that is testing for tactile fremitus, which is negative. I'm going to have you take a big breath in and expel. This is testing for symmetry, and his lung expansion is even and symmetric. I am now going to auscultate lung sounds. And can I have you take a deep breath? Okay. No adventitious lung sounds noted. I'm going to have you repeat that and say the word 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Bronchophony is muffled and unable to understand. I'm now going to percuss the areas and check for dullness. Okay, no dullness noted. Alright, I'm going to do the same thing on the front anterior of your lungs. I'm going to just touch and then say 99.
99, 99, 99, 99.
Okay, now I'm going to take a listen and you're going to repeat 99.
99, 99, 99, 99, 99, 99, 99, 99.
Okay. It is indistinct and muffled. Okay, now I'm just going to take a listen to your lungs. Okay. And again, no adventitious lung sounds noted. Okay. I am going to hand you this piece of paper. Can you read it and do what the instructions say?
Fold this paper in half and place it on the floor.
Thank you. Okay. Okay, so we did lungs. Next we are going to assess your cardiovascular cardiovascular system. So basically I'm going to start with your temporal arteries, your carotid arteries, listen to your heart, and then go down through your brachial, your femorals, your radial, your popliteal, your tibialis, and your dorsal pedis. So I'm just going to lightly palpate your temporals. Noted at 2+, carotid arteries. Okay, noted at 2+. I'm going to assess the brachial at a 2+, the radials 2+, the popliteal, and then the posterior tibialis, and then the dorsal pedis. And all pulses are 2+. Okay, so now I'm going to listen to your heart. I'm going to listen to the second intercostal space on the right side for your aortic region with the diaphragm of my stethoscope first. And then I'm going to move over to the second intercostal space on the left side, down to the third intercostal space in Ebbs point, and then the fourth intercostal space for the tricuspid, and then the fifth intercostal space midclavicular for the mitral. Okay. I'm going to listen again, just with the opposite side of my stethoscope, the bell side. And this is going to assess for any murmurs. Again, on the second intercostal space on the right. And then the second intercostal space on the left. Okay, and then we're going to go down to the third intercostal space, or the Ebbs point, and then the fourth intercostal space, and then the fifth intercostal space midclavicular. Only S1 and S2 noted. Okay. I'm going to take a listen to your carotid arteries and listen for any bruits. No bruits noted. Okay, can I have you lay down? Okay. All right, now we are going to assess for the aorta, which would be to the left of the midline of the umbilicus. And no bruit noted there. I'm also going to listen to the femoral arteries and the renal arteries while I'm here. This is the right renal artery and the left, and then the femorals. Okay, no bruits noted again. Okay. Okay, so now we're going to move on to the abdominal assessment. I'm going to inspect for symmetry, any excessive hair, any lumps, abnormalities. While I'm in this region, I don't see anything on him. I am now going to listen to your belly. I'm going to assess for vowel sounds in all four quadrants. I would assess each quadrant for up to 30 seconds. He is noted with normal vowel sounds. Next, I am going to lightly palpate the abdomen in all 4 regions for tenderness, distension, any guarding, noting anything facial grimacing that the patient might be doing, which he's all negative. I am going to assess the liver on the right upper quadrant and the spleen on the left upper quadrant. I'm going to also percuss for Tiffany. Okay, everything's good there. I'm going to percuss the lower abdomen as well, and then deep palpation, which would be 5 to 8 centimeters, assessing for pain, firmness, distension, all of that. The patient's abdomen is normal. Okay, so that concludes the abdominal assessment. Okay, now we're going to move into the musculoskeletal assessment. Okay, so are you able to adduct your leg, which is move it out? Okay, excellent. And then the other one? Perfect. Okay, and what about lifting one leg up and the other one? Okay, patient noted to have full roam. I'm going to now push down, and you're gonna resist it, okay? So if you can lift your leg and then lift up, great, okay, and then we're gonna do the opposite. Excellent, and we'll do this leg, and then, okay, so patient strength, we're gonna come down to the feet. Can you flex and extension? Okay, patient has appropriate roam. Can you push like you're driving? Okay, and pull. Okay, patient has good strength there. Okay, can I have you sit up? Right, okay, so can I have you do a shoulder shrug? Okay, and again, it's even and symmetrical. Can you not resist while you shoulder shrug? Okay, patient noted with good strength. Are you able to bend your elbows? Okay, and then release. And what about rotation? Excellent. And how about extension? Okay, patient's able to move all upper extremities. Can I have you stand up? Okay, can I have you lean forward and touch your toes? Okay, and then stand up. Can you lean back? Okay, excellent. What about side to side? Okay, and twist. Okay, patient has full roam of his torso. Okay, you can sit back down. Okay, can you look from left to right? Okay, while the patient's looking left to right, I'm also noting for jugular vein distension, which I don't see any. Okay, now I'm going to place my hand on the side of your head, and you're going to push against it. Okay. Alright, and this is checking for range of motion in the neck. What about twisting? Okay. Okay, cool. Great, thank you. Okay, so that is range of motion. I'm going to check capillary refills on his nails and inspect while I'm down here. Each nail. Let's see. Capillary refill is noted less than 3 seconds. Patient does have an abrasion on his right 5th digit. I'm going to also assess for capillary refill on each toe. Patient is noted with less than 3 seconds. Are you able to extend your fingers and then make a fist? And how about your wrist movement? Okay, patient has appropriate wrist movement. What about flexion and extension? Okay, great. Patient's noted with appropriate roam at this point. Okay, and I think that concludes our assessment for today.